This sounds like a placenta previa, meaning the placenta is covering the cervical opening, and we know that the baby is going to come out of the cervical opening, best case scenario, and if there is a placenta in the way, you can imagine that that is going to cause some fairly large problems. Sometimes your placenta can actually move far enough away from that cervical opening where a vaginal delivery would be considered safe, because as your baby grows and your uterus stretches, that placenta can kind of be pulled upwards away from the opening of the cervix. But come closer to the end of your pregnancy, if that placenta is still too close or covering the cervical opening, that's going to change some things. And the biggest thing is that a vaginal delivery will not be an option for you. And the other thing is that you shouldn't be having any cervical exams if you have a placenta previa, because you can imagine we could put our fingers right on through that. So you'll be teed up for a scheduled C-section, and they might actually want to do it before 40 weeks because they don't want to chance you going into labor. Let's pull up the benefits of a scheduled C-section. The first being, you know when your baby is going to be born, so you can make all of your life preparations ahead of time. The next is that a scheduled C-section is usually very calm, which is nice for birth. Obviously, the cons are that you're having a major abdominal surgery and your recovery is going to be fairly intense. They may also want to have an extra IV in place in case of any excess bleeding. And if your site doesn't normally do blood work before a C-section, you're going to break that mold because they're going to want to know your blood counts and your blood type. Oh, and in your pregnancy, if you have any vaginal bleeding at all or signs of labor, you need to report to your provider right away.